sports-related injuries. I'm thinking about heat strokes. We're in South Florida. This has to be so common.
Yeah, the thing about South Florida is that we're a year-round warm weather environment. So when you hear about heat-related illnesses, especially across the country, it tends to focus on summer months or late in the spring and early in the fall. Mm-hmm. We're year-round, so we really have to keep track of hydration and heat-related illness symptoms all year round, whether it's November, December, January, but especially in the summertime. Now, if you've been out in the sun been outside recently, it's been exceedingly hot, and we know that that heat index gets up pretty quickly.
Yes, you're absolutely right.
And what kids really don't know how to do is self-regulate and monitor hydration status and nutrition status. So it's up to us as parents to make sure they're really staying hydrated, well-fed, well-nourished, and making sure we're getting ahead of that dehydration.
And now when it comes to injuries, though, we're seeing so many young players and young kids getting into sports, which is amazing, but at the same time, they don't know their body so well. They're kind of figuring out, and here's where the injuries come in. Mm-hmm. How do we prevent that? How can we stop that, and why?
Well, one of the things I always tell parents that ask me, how do I prevent my kid from getting X, Y, or Z is have the kid listen to the body. One of the most common injuries we see in sports, especially in young kids, is overuse injuries. So this is a very competitive environment we're in. Kids are always trying to get to the next level. They're competing in one sport almost year-round now, which isn't recommended. The American Academy of Pediatrics does recommend to have multiple sports for kids. Okay, listen to your body. If something starts to hurt, if there's kind of an injury that's kind of nagging, if your kid is saying, it hurts when I throw, it hurts when I run, stop. Get it evaluated by a medical professional, by your pediatrician, and then make an assessment whether you can continue that sport.